Dear ladies and gentlemen, buenos dias. My name is Professor Carsten Knobloch from Hanover, Germany, and this is my distinct pleasure to introduce you to fast oscillating magnetic field therapy, EMTT, in MSK. I am a private surgeon based in Hanover. I'm the current vice president of the ISMST. I'm the past president and general secretary of the German Shockwave Society, DGEST, and a board member of the German EMTT Society, DGEMT. You are maybe familiar with the concept of the comfort zone, where you feel safe and in control, followed by the fear zone with the lack of confidence and where you find excuses, followed by the learning zone, coming lastly to the growth zone, where we find purpose, may live your dreams and set new goals. So great things never came from staying in the comfy zone. So please step outside your comfort zone where the magic happens, magic like this. So EMTT is extracorporeal magnetotransduction therapy. It is a novel technology based on fast oscillating high frequency magnetic pulses. So I start with some physics. The principal setup in a EMTT machine is based on a high voltage power supply with a diode, followed by a capacitor, a switch, and an applicator coil. In EMTT, the Maxwell formula is pretty important, showing the relationship in between magnetic fields and electric fields, where frequency matters. So if you compare on the left-hand side an EMTT from a shockwave on the right-hand side, you see distinct oscillations in the EMTT. If you compare EMTT on the left-hand side and PEMF, pulsed electromagnetic fields, on the right-hand side, you see the speed of the EMTT impulse is much, much faster than the slow PEMF impulse. I will show you later. And to elicit a biological response, you will have to have at least a 10 millitesla threshold to achieve any biological response. And if you put the 10 millitesla threshold on the oscillations of one single EMTT impulse, you see that within 70 microseconds, 10 oscillations are happening. And if you can calculate that with a current device up to 10 Hertz, you might achieve 100 biological reactions within a single second. So if you apply, for example, 4,000 shots with the EMTT on a tendon, you can calculate around 40,000 biologically active reactions. So there are clear physical differences in between PEMF and EMTT, which is very important. And I showed you before that EMTT is much, much faster than a slow single PEMF oscillation. So EMTT is some 40 times faster than PEMF. And if you compare PEMF devices on the market in Europe, for example, on the left-hand side from BTL and Zimmer Emfield, these devices usually achieve effective transduction powers measured in kilotesla per second lower than 60, while EMTT by definition has higher effective transduction powers like Magnetolith 65, Papimi 72, or Theracell. So there are EMTTs are much faster, 40 times, and much stronger in contrast to PEMF devices. Both PEMF and EMTT work most likely on ion channels. There is a recent very interesting paper speaking on the bioelectricity revolution and the electron, because there is in each and every biological structure, there are membrane potentials and voltage changes, and these voltage changes can be influenced by the magnetic fields. As you remember, the Maxwell formula showing the interaction of electric fields induce magnetic fields and vice versa. So there is huge interaction, and you see, for example, on the left-hand side for the DNA, on the right-hand side for the RNA, membrane potentials in these proteins, and even on a very cellular level, you see the membrane potentials of different items like the mitochondria, the lysosomes, and so on. And you might even change might even influence, for example, the immune reaction on macrophages by changing the membrane potential. So even changing the membrane potential can change in between non-proliferating cells into proliferating cells. So it appears that these bioelectric activities might be one of the actions where the EMTT and the PEMF devices come into play. And this has been proposed by Ludger Gerresmeier as well. And he's saying or speculating that even cytoskeleton remodeling and membrane bending might be some of the effects the magnetic fields are eliciting. We are aware that electroporation is one of the physical mechanisms EMTT is working with, as well as a piezoelectric effect, especially on bone issues. If it comes to contraindications and you are having a patient with an implant, if the implant is MRI safe, then it appears to be safe to be operated with the EMTT device as well. If you are having a patient with a pacemaker or a defibrillator, it is wise to have at least a distance of 20 centimeters or more, because there might be some interaction of the strong electromagnetic fields and the pacemaker and the defibrillator programming. If you're having a tattoo in the treatment area, there might be some heating within the ink of the tattoo if a very old ferromagnetic ink was used, but usually neither the patient nor the tattoo artist is aware whether or not it's ferromagnetic ink. So my approach in this case is to start with, say, energy level 5, and I'm staying with the patient and slowly increase the energy levels. And if there is some heating encountered, I would stop EMTT. However, in all my 8 years of EMTT experience, I never ever encountered any of these issues yet. The PEMF and the EMTT seem to stimulate different pathways. So via TGF and BMP, there might be some enhancement of proliferation, osteogenesis, and chondrogenesis on the one hand side. Via adenosine receptors, subtype 2A and 3, there might be even modulation of pro-inflammatory cytokines. We have some clinical data yet, especially for PEMF, showing that in osteoarthritis, it is wise to use it. There are papers out there showing it's beneficial for tendons, as you can see here for rotator cuff tears with upregulation, for example, in these proteins. We see pretty nice results on mesenchymal stem cells. We see clinical results on osteoarthritis as shown here in a big meta-analysis. And even on the skin and on wounds, it appears that PEMF and fast oscillating magnetic fields can enhance the healing of diabetic wounds quite significantly. In the veterinarian field, it is used quite extensively, as you can see here, in dogs, in horses, in cats. So I myself started EMTT on November 23 in 2016, so nearly 8 years ago, with a TheraTherm machine. Started first on myself and then becoming more confident with the techniques. After a week, I started with my first patient, a professional soccer player suffering from patellar tendinopathy, where I added EMTT in addition to ultrasound-guided injections and shockwave therapy. In March 2020, the EMTT magnetolith came on the market, and I had the pleasure to be the first to receive the machine. So my first patient was a 77-year-old professional singer with plantar fasciitis, as you can see here in the ultrasound, where I combined focus shockwave and EMTT in order to enhance healing. Another patient, 80-year-old, Achilles tendon rupture, non-operative treatment, where I tried to have some tendon accelerated healing in this situation. Epicondylitis after video gaming, or even trigger finger, where I combine shockwaves, maybe injections, and EMTT. on the trunk bone situation, especially osteoides pubis. So symphysitis is very nice indication where you can touch free without gel and with the clothes on can do your treatment quite significantly with, for example, 6,000 shots, which are usually used. And we have even some early reports that the MRI bone edema can be significantly positively influenced by EMTT. And in this small cohort published by my friends, after 4 EMTT treatments, within 2 weeks, there was a significant, or there may be a significant decrease in pain in osteoides pubis. Coccygynia is another very nice indication where EMTT is quite helpful, as you can see in this gentleman, the lower extremity, especially in adolescent, for example, Osgood-Schlatter disease. It is a very nice pain-free treatment option. My youngest patient up to date was 9 years. However, if there is anybody even younger, I would not stop with the EMTT, but even encourage because it's a pain-free potential treatment. And my oldest patient up to date is a 91-year-old gentleman with spinal stenosis who has been operated beforehand, as you can see here. In the year 22, so 2 years after I start with the magnetolith machines, I had some 2,000 treatments. My patients are mainly males, main age 53. And at that point of time, my mean shots per session was 3,400 shots with 3 sessions per patient. I usually did EMTT only in only 4%. In majority of my patients, because I see a lot of tendons, I'm combining shockwaves and EMTT, as you see in 69%, and in tendons and sometimes in osteoarthritis, I'm even doing injections. Another quarter of my patients received EMTT, combined shockwave and injections. So give you an idea. And in my practice, where I in the majority combine EMTT with shockwave, I usually apply magnetolith with in tendons with 4,000 shots, in bone edema around 6,000 shots, and on the spine usually with 8,000 shots to give you an idea of how I do it. And in the early phase, we even had a register of some 3,000 treatments with Storz with 7 different colleagues, including myself. And the mean shot count was 4,000 shots per treatment, as you can see here in the box plot. Usually energy-wise, the majority, 85%, was using energy levels 8, some 5%, 7, 8%, 6, and lower than 5, nearly no. So in majority of cases, energy level 8 out of 8 was applied in a let's say, pain-free fashion. If it comes to the frequencies, as you can see here, the pattern is a bit different. So majority was 8 hertz. However, still there was a reasonable number of patients receiving 4 or 5 hertz. Up to date, we do not have comparison or comparative trials showing whether 8 hertz or 6 hertz or 5 hertz is better. But in the moment, preferably, usually we apply with 8 hertz. So coming to the end, lasers and shockwaves are doing mechanotransduction and therefore induce some genetic changes. And the EMTT is using magnetotransduction to achieve beneficial biological effects. Thank you very much for your attention.